Pancreatic cancer is known as the silent killer. Especially in older adults, its symptoms are often vague and mistaken for other common issues related to aging. But recognizing the early signs can make a life-saving difference. In this video, we'll go over the key symptoms of pancreatic cancer in the elderly, and what you should never ignore. 1. Unexplained weight loss. One of the first signs of pancreatic cancer, especially in older adults, is unexplained weight loss. While losing weight might sound like a good thing to some, when it happens suddenly and without effort, it's often a warning sign. We're not talking about losing a few pounds after eating healthier or walking more. This is the kind of weight loss that seems to happen for no clear reason. For example, imagine someone who eats the same way they always have. They haven't changed their daily habits, but over a few weeks or months, they notice their clothes are looser, their belts need a tighter notch, or friends begin to comment on how much smaller they look. In older adults, this type of unintentional weight loss is often dismissed as part of aging or stress, but it shouldn't be. When it comes to pancreatic cancer, there are a few reasons why this happens. First, the pancreas helps the body digest food. If the pancreas isn't working properly, the body can't absorb nutrients like fats and proteins. That means even if someone eats regularly, their body may not be getting the fuel it needs. The result? They start to lose weight quickly. Second, tumors in the pancreas can affect hormones that control appetite or cause inflammation in the body that speeds up metabolism. People may also feel full quickly or lose interest in eating altogether, especially when meals lead to bloating or discomfort. The danger is that many people ignore this symptom. They may feel relieved to lose a little weight, especially if they've been trying to, but if that weight loss comes without trying and is more than 5 to 10% of body weight in a short period, it's time to get checked out. In summary, if you or a loved one is losing weight without trying, don't assume it's just age. It could be your body's way of saying something is wrong, and the sooner you find out why, the better the chances of treating it early. 2. Abdominal or back pain. One of the more subtle but concerning symptoms of pancreatic cancer in the elderly is persistent abdominal or back pain. This pain often begins in the upper abdomen, just below the ribs, and may radiate to the middle or lower back. It might start off mild, even easy to ignore at first. But over time, the pain can become constant, and in some cases, even severe. What makes this symptom tricky is that it can easily be mistaken for common age-related issues like arthritis, indigestion, or spinal problems. Older adults might assume it's just a sore back or something they ate. But here's the difference. Pain caused by pancreatic cancer doesn't go away with rest or typical pain relievers. It often feels deep, dull, and gnawing, not sharp or sudden. In many cases, this discomfort worsens after eating or when lying flat. Some people find that curling forward or assuming a fetal position gives temporary relief. That's because a growing tumor in the pancreas can press against surrounding nerves and organs. If an elderly person complains of persistent pain in the abdomen or back that doesn't seem to have a clear cause, especially if it's accompanied by other symptoms like weight loss, fatigue, or digestive changes, it's time to see a doctor. Early imaging tests, like a CT scan or MRI, can help identify potential problems in the pancreas. Don't ignore lingering pain, even if it seems minor. In older adults, symptoms like this can be brushed off too easily. But recognizing them early and taking them seriously could lead to faster diagnosis and better outcomes. 3. Jaundice, yellowing of the skin or eyes. Jaundice is one of the most noticeable and serious warning signs of pancreatic cancer, and it should never be ignored, especially in elderly individuals. Jaundice occurs when there's a buildup of a yellowish substance in the blood called bilirubin. Bilirubin is produced when the body breaks down red blood cells. Normally, it's processed by the liver and released through the bile ducts into the intestines. But when a tumor forms in the head of the pancreas, it can block the bile duct, preventing bilirubin from exiting the body properly. This causes it to build up in the bloodstream, and that's when symptoms start to appear. The first signs of jaundice may be subtle, a slight yellow tint in the whites of the eyes, darker than usual urine, or pale, clay-colored stools. As bilirubin levels increase, the yellowing becomes more obvious, affecting both the eyes and the skin. It's important to understand that jaundice is not a disease itself, it's a symptom of an underlying condition. And in elderly patients, it can often be confused with liver problems or side effects of medications. But when jaundice appears along with other symptoms like unexplained weight loss, abdominal discomfort, or fatigue, it raises a strong suspicion for something more serious, such as pancreatic cancer. In some cases, patients may also experience itchy skin, which can be intense and persistent. This itching is caused by bile salts building up under the skin, another result of blocked bile flow. Unfortunately, elderly people may dismiss this as a skin condition, or even just dry skin, especially in colder weather. Because pancreatic cancer is often diagnosed late, any sign of jaundice should prompt immediate medical attention. A simple blood test, imaging like an ultrasound or CT scan, and liver function tests can help determine the cause. Early detection can save lives, and in many cases, noticing jaundice early is the first step toward a faster diagnosis and potentially more effective treatment. 4. Digestive problems. One of the most overlooked symptoms of pancreatic cancer, especially in elderly individuals, is digestive trouble. This can include bloating, nausea, vomiting, indigestion, or feeling full too quickly after eating. These symptoms might seem minor or easy to explain. Perhaps it's just a bad stomach or something they ate, but if they persist, they should never be ignored. The pancreas plays a crucial role in digestion by producing enzymes that help break down fats, proteins, and carbohydrates. When a tumor grows in or around the pancreas, it can interfere with this process, leading to poor digestion. As a result, food may not be broken down properly, which can cause abdominal discomfort, gas, and even frequent diarrhea. Some people may also notice their stool becomes pale, greasy, or floats, a sign that fat is not being absorbed properly. Another sign to watch out for is a loss of appetite or early satiety, when someone feels full after only a few bites. This could be due to the tumor pressing on surrounding organs or nerves, or from poor enzyme production causing the stomach to empty more slowly. In many elderly patients, these symptoms are often attributed to aging, ulcers, or common GI disorders like IBS or acid reflux. That's why it's so important to look at the full picture. If these digestive issues are new, getting worse, or happening alongside other symptoms, like weight loss or fatigue, it's time to raise concern. Healthcare providers can perform imaging tests, blood work, or refer patients to specialists to rule out serious causes like pancreatic cancer. Early testing could be the key to early diagnosis, which greatly improves the chance of treatment success. Bottom line, persistent digestive issues in the elderly, especially if they're unusual or worsening, deserve attention. Don't write it off as just aging. Listen to your body and seek help when something doesn't feel right. 5. New onset diabetes. Did you know that sudden diabetes, especially in older adults, could be an early sign of pancreatic cancer? While most people think of diabetes as a lifestyle-related disease, in some cases, it actually starts because of changes in the pancreas itself. The pancreas is responsible for producing insulin, which helps regulate blood sugar. When a tumor begins to grow in the pancreas, especially in the areas that produce insulin, it can disrupt this delicate balance. As a result, blood sugar levels may suddenly rise, even in people who have never had diabetes before. This condition is called new-onset diabetes, and it's particularly suspicious when it appears in people over 60, without the usual risk factors like obesity, poor diet, or family history. Doctors have found that in some cases, this form of diabetes shows up months before other symptoms of pancreatic cancer, like jaundice or abdominal pain. That's why it's considered one of the earliest silent warnings. It's also important to look at the pattern of diabetes. If someone is suddenly needing more insulin, or their blood sugar is unusually difficult to control, even with medication, it may be more than just diabetes. In some studies, about 1 in 100 people over age 50 who develop new-onset diabetes may be diagnosed with pancreatic cancer within 3 years. If you're caring for an elderly parent, grandparent, or patient, and they've recently developed diabetes without clear reason, it's worth bringing this up with their doctor. A simple blood test, scan, or referral to a specialist can help rule out, or catch, something more serious. Early attention could lead to earlier diagnosis. And when it comes to pancreatic cancer, timing can mean everything. 6. Extreme fatigue. Fatigue is common among older adults. We all slow down a bit with age. That's natural. But when we talk about extreme fatigue, we mean something different. It's not just feeling tired after a long day. It's a deep, persistent exhaustion that doesn't go away with rest or sleep. In people with pancreatic cancer, fatigue often shows up early, long before the cancer is diagnosed. It can be one of the body's first signals that something serious is going on. And sadly, it's often ignored or chalked up to aging, stress, or poor sleep. So what causes this kind of exhaustion? One major reason is that the pancreas isn't working properly. When the pancreas is affected by cancer, it may not release enough enzymes to help digest food. That means the body isn't getting the nutrients it needs, even if the person is eating regular meals. And when your body can't fuel itself, energy levels plummet. On top of that, cancer itself triggers inflammation and releases chemicals called cytokines. These chemicals can interfere with how the body uses energy, causing that drained, heavy feeling all day long. For elderly people, this fatigue can lead to other problems, like trouble walking, balance issues, and even depression. And because they may already have other health conditions, it's easy to miss the bigger picture. But here's the key. If someone you love suddenly becomes unusually tired, sleeps much more than usual, or starts to withdraw from daily life, that's not just old age. That's a sign to ask questions. And possibly, to see a doctor. Remember, when it comes to pancreatic cancer, early warning signs are often subtle. But extreme fatigue, out of the blue, and without a clear reason, is one we should never ignore. 7. Depression or mood changes. One of the lesser-known, yet surprisingly common, symptoms of pancreatic cancer, especially in the elderly, is a sudden change in mood. It might seem unexpected, but research has shown that depression, anxiety, or emotional shifts can appear even before a diagnosis is made, and sometimes even before physical symptoms like pain or weight loss show up. This can be especially concerning in older adults, where mood changes are often dismissed as part of aging, loneliness, or other life stresses. But when an elderly person who's typically upbeat or emotionally stable suddenly becomes withdrawn, sad, anxious, or unusually irritable, it might be a signal from the body that something more serious is going on. So, why does this happen? Doctors believe that the cancer itself, or the immune response it triggers, can affect the brain's chemistry. Inflammation caused by the tumor may alter neurotransmitters, like serotonin and dopamine, which are responsible for regulating mood. This isn't just about feeling down. It can be a biological reaction to the disease. It's also important to consider the emotional burden of subtle symptoms. An elderly person may sense that something is wrong, even if they can't explain it, and this inner worry or confusion can lead to depression or fear. They may not tell anyone because they don't want to be a burden. That's why caregivers and family members need to pay attention not just to physical health, but also to emotional well-being. If a loved one suddenly shows signs of depression, especially if it's out of character or accompanied by other physical changes, don't just chalk it up to age. Encourage them to see a doctor. Mental health is part of overall health, and in some cases, it could even be an early warning sign of a deeper issue, like pancreatic cancer. Pancreatic cancer is often diagnosed late, but it doesn't have to be. Early detection can improve the chances of treatment and survival. If you or a loved one notice any of these symptoms, don't wait. Talk to a healthcare provider. And please share this video, it could save a life. If you found this helpful, don't forget to like, subscribe, and turn on the notification bell for more health tips from Health 999.